my name is Colleen, and here I am to present on the benefits of early administration of naloxone in documented cases of heroin overdoses. At the end of this presentation, everyone here should be able to identify these three objectives: to recognize the high incidence of mortality in documented cases of heroin overdoses, to define the secondary and tertiary interventions that can be implemented to decrease mortality from heroin overdoses, and to summarize the research studies that have demonstrated the impact of these interventions to decrease mortality from heroin overdoses. Drug-related deaths increased 92.7% worldwide between 1990 and 2013, and drug overdoses have been the largest cause of injury-related deaths among U.S. adults since 2008, a trend driven by increased opioid overdose mortality. More recently, an increase in heroin overdose deaths have been observed in several states, with some areas noting a marked transition from overdose deaths involving opioid analgesics to heroin overdoses. Unfortunately, opiate addiction and related deaths are projected to increase. The number of drug deaths in New Hampshire for 2016 surpassed the previous year's record of 439, according to analysis from the State Medical Examiner's Office. The total projected number was approximately 494 deaths in 2016, according to Chief Forensic Investigator Kim Fallon. The research on this problem resulted in data from 5 primary research articles. These articles include 2 randomized controlled trials, a retrospective cohort study, a randomized study, and a quasi-experimental study. The aims of these research studies are to demonstrate the benefits of knowledge, training, and providing community access to naloxone to at-risk populations. 3 of these articles presented their research with 95% confidence intervals, which assumes that the researcher is 95% confident of the results and 5% probability that it lies outside the range. The aim of this project is to research the incidence of the early administration of naloxone in individuals with suspected heroin overdoses. Naloxone, a short-acting mu-opioid antagonist with no abuse potential, is recommended by the World Health Organization and others as a key strategy to reduce mortality related to opioid overdoses. Naloxone has been distributed to heroin users to facilitate late reversal of opioid overdoses since the mid-1990s. Providing take-home naloxone supplies to heroin users and their peers for use in subsequent emergency overdose situations is a novel prevention approach. It has been suggested that 2/3 of opioid overdose fatalities could potentially be avoided by emergency naloxone administration by peers. The 4 elements of the PICO question are: the population problem in this research is the incidence or mortality caused by suspected heroin overdoses. The intervention is the early administration of naloxone. The comparison is to provide community education on the importance of naloxone administration immediately once a heroin overdose is suspected. The expected outcome for this research is to decrease mortality rates of suspected heroin overdoses by 50%. Dr. Betty Newman has been recognized as a pioneer in the field of nursing for her dedication to community mental health. Her model was developed while she was teaching at UCLA. In 1972, her model was first published as a model for teaching total person approach to patient problems in nursing research. The goal of her model was to provide a holistic overview of the physiological, psychological, sociocultural, and developmental aspects of human beings. The theory focuses on the response of the patient system to actual or potential environmental stressors, and the use of primary, secondary, and tertiary nursing prevention interventions for retention, attainment, and maintenance of patient system wellness. Primary prevention aims to prevent disease or injury before it ever occurs. This is done by preventing exposures to hazards that cause disease or injury, altering unhealthy or unsafe behaviors that can lead to disease or injury, and increasing resistance to disease or injury should exposure occur. Even the goal of her theory is primary prevention. The benefits of early administration of naloxone in suspected heroin overdoses is an example of a secondary intervention. Secondary prevention aims to reduce the impact of a disease or injury that has already occurred. The importance of community education on the administration of naloxone to individuals with suspected heroin overdoses by friends and family members is a tertiary prevention. Tertiary prevention aims to soften the impact of an ongoing illness or injury that has lasting effects. This is done by helping people manage long-term, often complex health problems and injuries. For example, chronic diseases or permanent impairments, to improve as much as possible their ability to function, their quality of life, and their life expectancy. The importance of this research problem is on secondary and tertiary prevention, which is another vital aspect of Dr. Newman's theory. To attempt to rehabilitate this population, these treatments should be readily available in the community, and early administration of naloxone is necessary. In conclusion, with the implementation of the secondary and tertiary interventions in the research, the result will allow for retention, attainment, and maintenance of this population system wellness. Many factors can affect how the public view this growing health concern of heroin overdoses in our country and around the globe. The most important is lack of knowledge and training, and then the fear of liability for your actions. 3 of these articles were chosen for this review because their research was focused on the effects of knowledge and training in hopes of increasing public support for this treatment. Another article analyzed data from the Drug Overdose Prevention Education Project, also known as DOPE, a San Francisco County overdose prevention and naloxone distribution program in operation since 2003. DOPE was the first naloxone distribution program in the United States to be sanctioned and supported by a health department. The 5th article in this review approached the legal aspect of naloxone administration by law enforcement officers. Both emergency medical personnel, EMS, and law enforcement officers, responders who administer naloxone typically do so under what is termed a protocol or standing order, whereby a medical professional who is authorized to prescribe the medication empowers authorized individuals to administer to a person who meets specified criteria. These articles look at multiple interventions that improve the outcomes of this unfortunate population, heroin users. The first study, completed by Bashhuber et al. In 2014, was conducted through a web-based internet survey to 1,598 participants. The survey questionnaire was structured in Likert style and no tool or instrument was used. The data was measured by ratio and percentages, and there are no tests or retest data. The study was completed from September 18th to October 13th in 2014. Factual information and the sympathetic narrative alone led to higher support for training first responders to use naloxone, providing naloxone to friends and family members of people using opioids, and passing laws to protect people who administer naloxone. Participants receiving the combination of the sympathetic narrative and factual information compared to factual information alone were more likely to support all policies providing naloxone to friends and family members, training first responders to use naloxone, passing laws to protect people if they administer naloxone, and passing laws to protect people if they call for medical help for an overdose. The next two studies were completed through two community programs supported by their state departments of public health. Doe Simpkins et al. Compiled program data from the Massachusetts Opioid Overdose Prevention Pilot Program among participants who reported any substance abuse in the 30 days prior to enrollment. The study was conducted from 2006 to 2010. It was not retested. Among 4,926 substance-using participants, 295 trained and 78 untrained participants reported one or more rescues, resulting in 599 rescue reports. A closed questionnaire completed by staff was conducted through personal interviews. No tool was used for this study. Ratio percentages measured this data. The study was conducted from 2006 to 2010. It was not retested. Another article analyzed data from the Drug Overdose Prevention